So if you are a person who spends a lot of time in this flexion state, which is probably why you're here, we talked a little bit about the digestive issues that can occur when you are compromising and compressing this general area. So this area is where all of our organs are that need to have space to obviously do the things that they do. Digest our food, eliminate our food, move our waste through our body. So there's probably some sort of congestion that's happening here. Either you're having too rapid of an elimination cycle, which means you're having loose stools, or the opposite, moving a little bit too slowly, not having enough peristalsis, ending up with some sort of constipation or hardening of your stools. So either way, we want to just get this area with more blood. We're going to start thinking about pumping it from side to side, and we're going to actually use our own tissue. So if you have a lot of belly tissue or fat, don't worry about it. That's actually going to come in handy on this one. So truthfully, the thinner you are, it does get a little bit more difficult because you don't have as much to scoop. So we're going to actively scoop our contents of our abdominal cavity. We're going to move them from side to side, and we're basically stimulating that peristalsis, that natural movement that our organs usually are doing. They're usually contracting and squeezing and having their own little whole thing going on, which is what actually moves your food through your body. So I like to put my hands kind of together like this so that they're in a bit of a scooping motion. One hand on the outside is helping that inside hand with the scoop. So a lot of times we can scoop with our heel a little bit better instead of putting all that pressure onto our fingertips themselves. The fingertips are just kind of a more pokey type of feeling. So the heel of the hand creates a nice soft pressure that we can push and scoop with. So we're gonna have that hand right at the top of our pubic hip bone. We're going to go pretty much all the way into the side. So you have this small hole between your rib cage and your hip. We're going to put our fingertips right there, and then we're going to hit the heel of the hand right on top of those fingertips. We're going to think about pushing and scooping. So you see how much tissue I'm actually pushing and scooping. I'm letting it all push and scoop to the other side, where now this heel is in that exact same position. So I've ridden that heel all the way over, and now this heel, I'm able to get into that exact same position, really all the way on the side here, right in between my hip bone and my ribs. I'm gonna lock in again, and I'm gonna pull everything over. I'm doing this sitting up for obvious reasons of the video. You would want to do this lying down. So when you're laying down, obviously it becomes a lot easier. All of this softens down because you're not using your actual core to hold your body up or any of your postural muscles to hold you up. So you're going to be able to relax a lot better. I will sometimes even do this over like a soft night shirt or just your t-shirt, so you don't have to be right on your skin and you don't have to get lotion or oil or anything like that. If you have kind of a softer thing that you sleep in anyway, I find that tends to be a nice slip, and you still are able to scoop and slip over. Each pass should take 10, 20 seconds, right? So I'm moving pretty slowly and I'm pushing my organs. So you can see how much wrinkling I'm creating here. I'm really trying to squish everything. If you've ever kneaded pizza dough or made bread before, that's a very similar action. So we're just scooping and pulling, scooping and pulling. You'll want to go back and forth maybe 10, 20 times. If you're consistent with this, though, you will see a change in your eliminations. And if you have eaten too much and just feel a little, wait a couple hours and do this. It'll be pretty awesome. So this really, really helps. any of that extra that's just holding in your body. And trust me, most of us have at least 10 pounds of impacted matter still left in our colon. So if you want to lose a little bit of weight too, this is a nice little way to go about that. But one of my favorite sayings is more space out than in. So let's get it out, okay? All right, give it a try.